When you are young and fit, you often feel that you will always be that way. A healthy body and mind is a gift that needs to be nurtured. The lifestyle you choose has a direct effect on your health and happiness. So, let's have a look at the choices that you can make to enable you to lead a long, healthy, and hopefully happy life. Obviously, not everyone is good at sporting activities, but it can be fun to join in some, or just take your own exercise, walking or jogging. But whatever you do, make sure that you take regular exercise to keep your body muscles working. Keeping your brain active is an essential part of staying healthy. To ensure your brain remains active, you need to do something where your brain has to actively make decisions and interpret what you are looking at and working on. It can be learning a language, researching something, doing crosswords puzzles, or DIY work where you get involved in measurements and layouts, etc. Food and drink have a significant effect on your health. We need to look at these in more detail. The next two slides will look at food and drink, respectively. Food is an essential part of daily life. The phrase, "you are what you eat," is a true reflection of how the food you eat affects your body. Too much fatty food will increase your weight and affect your muscles so that activities become more difficult, or in some cases impossible. Too little food lowers your weight and reduces the strength in your muscles, which makes you too weak to do some of your normal activities. There is nothing wrong with giving yourself an occasional treat, providing you don't overindulge. I'm sure the school will have some leaflets on recommended food types and levels to distribute to you. Drink is essential for survival. The important thing is ensuring that you drink enough non-alcoholic water-based products to keep you hydrated. Lack of hydration affects both the brain, you become muddled and distracted, and the body, you become weaker and unable to control movement effectively. Alcohol, if drunk in big amounts, adversely affects your brain and body. It muddles the brain and affects your control of physical movement. If you ever get drunk and out of control, make sure you stay with your friends or contact the security staff or hotel manager. There is nothing wrong with having an occasional drink at a party or other social function. Never drink alcohol on a daily basis, as it will affect your life and work decisions. It could also lead to your becoming an alcoholic. Remember, healthy food, sensible drinking, and regular exercise of the body and brain will ensure you have a long, active, and hopefully happy life. According to internet research, the NHS treats approximately 560 million patients annually, of which 10 million are surgical procedures. It has claims for poor treatment of approximately 13,500 annually. That is about 0.03%. While some of these are relative to general treatment, most are probably relative to surgical procedures. If we assume that 13,400 claims are relative to surgery, the ratio is about 0.14%. While I'm sorry for the pain and distress caused to patients and their relatives, and fully believe they should receive compensation, it is important to accept that these calculations indicate that the NHS has a 99% record for providing quality and successful treatment for surgery and other medical treatments, ensuring the best results for all patients concerned. Before we look at the NHS in more detail, we need to look at the situation that applied before 1948. Before the NHS was formed, doctors and hospitals all charged for medical care. There were a few charity hospitals, often run by religious organisations. People who had no money were usually sent to the workhouse, where men and women, including children, lived in separate dormitories and were fed and clothed in exchange for working long hours in the workroom. The Poor Laws in Britain were officially abolished in 1948 with the passing of the National Assistance Act. However, some say that the workhouse system effectively ended in 1929 when the Local Government Act was passed. In the 1950s, I can still remember my mum often saying that Hill House Hospital had been a workhouse, and she felt sorry for the patients receiving mental health treatment there. The diseases on this slide, and many others, caused millions of deaths and life-changing disabilities worldwide prior to the discovery and introduction of vaccinations. If you want you and your children to enjoy a full life, take up the offer of free vaccinations on the NHS. Unfortunately, a small number of people suffer side effects, the details of which you can find on the official government records for the NHS on the internet, and decide if the benefits outweigh the risk of side effects. Usually the odds are in favour of taking the risk and having the vaccinations. This slide shows a brief history of my NHS treatment. The success of the NHS, coupled with better living standards, has increased the average life expectancy for men and women from about 60 years old in 1930 to currently about 82 years old. See student activities on the next slide. Best wishes to you all. Bye for now.